You've had a blood test and been given an HbA1c number. Perhaps it was 42, 48, 55, or even higher. But what does that number actually mean? Does it mean you have prediabetes? Does it confirm type 2 diabetes? And can you bring your HbA1c back down? In this video, we'll explain HbA1c, look at the important ranges, and explain what your result may mean for your health. HbA1c stands for glycated hemoglobin. That sounds complicated, but the idea behind it's actually quite simple. Hemoglobin is the substance inside our red blood cells that carries oxygen around the body. When glucose circulates in the bloodstream, some of it naturally attaches to hemoglobin. The more glucose we regularly have in our blood, the more of it becomes attached to our red blood cells. The HbA1c test measures how much glucose has attached to that hemoglobin. Because red blood cells remain in circulation for several months, the result provides an estimate of our average blood glucose over approximately the previous 2 to 3 months. This is different from a finger prick glucose test. A finger prick shows what our blood glucose is doing at that particular moment. It can change depending on what we have recently eaten, our activity, sleep, stress, illness, and medication. HbA1c gives us a broader picture of what has been happening over time. So, what do the numbers mean? In the UK, HbA1c is usually measured in millimoles per mole, written as mmol per mole. An HbA1c of 41 or below is generally considered to be below the prediabetes range. A result between 42 and 47 is usually described as prediabetes, non-diabetic hyperglycaemia, or being at high risk of developing type 2 diabetes. An HbA1c of 48 or above is within the diabetes range. However, one test result should always be interpreted by a healthcare professional. When someone does not have clear symptoms of diabetes, a second blood test may be needed to confirm the diagnosis. It is also important to understand that these numbers are not separate boxes with nothing happening between them. Risk does not suddenly begin at 42 or suddenly become serious at 48. HbA1c sits on a scale. Generally, as average blood glucose rises, the risk of progressing to type 2 diabetes and developing health complications also rises. This is why a result in the prediabetes range should not be ignored. Prediabetes does not mean that developing type 2 diabetes is inevitable. It is a warning that blood glucose regulation is becoming more difficult, but it also provides an opportunity to take action early. Changes to food, body weight where appropriate, daily activity, sleep, and other lifestyle factors can improve insulin sensitivity and help bring blood glucose down. Now let us look at what an HbA1c result means if we already have type 2 diabetes. For many adults with type 2 diabetes, an HbA1c around 48 or 6.5% may be used as a treatment target. But targets are individual. Some people may be given a different target depending on their age, medication, risk of low blood glucose, other health conditions, and personal circumstances. A result above the target does not mean that we have failed. It simply shows that our current food choices, lifestyle, medication, or treatment plan may need reviewing. The number is information, not a judgment. It is also worth remembering that HbA1c is an average. Imagine two people with exactly the same average result. One person may have fairly steady blood glucose throughout the day. The other may experience repeated high spikes followed by sharp falls. Their HbA1c could look similar even though their daily blood glucose patterns are very different. This is why finger prick testing or a continuous glucose monitor can sometimes provide extra information that HbA1c alone cannot show. HbA1c is extremely useful, but it is not perfect. Certain conditions that affect red blood cells can make the result less reliable. These may include some forms of anemia, recent significant blood loss, blood transfusions, and certain inherited hemoglobin conditions. Pregnancy and some medical conditions may also affect how diabetes is tested or diagnosed. Your healthcare team may use fasting glucose, an oral glucose tolerance test, or other blood tests when HbA1c is not considered suitable. So, how quickly can HbA1c change? Because the test reflects the previous 2 to 3 months, it will not usually show the full effect of a lifestyle change after only a few days. However, more recent weeks can have a stronger influence on the result than the earliest weeks in that period. This means that consistent changes can begin making a meaningful difference before the next test. The aim should not be to chase a perfect number overnight. It should be to create habits that gradually improve blood glucose and can be maintained in real life. This could include building meals around protein and minimally processed whole foods, reducing sugar and refined carbohydrates, limiting foods that cause large glucose rises, walking after meals, including resistance activity, improving sleep, and taking medication as agreed with your healthcare team. Never stop or change diabetes medication without speaking to an appropriate healthcare professional. The most important message is that HbA1c is not simply a label. It is a useful sign of what has been happening inside the body and a way of measuring whether things are moving in the right direction. Below 42 is outside the UK prediabetes range. Between 42 and 47 is the prediabetes or high-risk range, and 48 or above is within the diabetes range and may require confirmation if there are no clear symptoms. Whatever your result, there are usually meaningful steps that can be taken. In our next video, we will answer the question many people ask immediately after receiving their result. I've been diagnosed with prediabetes or type 2 diabetes. What should I do first? Subscribe to Diabetes Food Truth for simple, practical guidance on food, blood sugar, and type 2 diabetes. And let us know in the comments. Were you properly shown what your HbA1c number meant, or were you simply given the result and left to work it out for yourself?